Hi, everybody. Welcome to the DEI Town Hall. This is being held by request of membership. And for anyone who has issues or questions or advice, leadership within DEI is in the room. And I'm going to go through, after Dr. Cross speaks, how DEI is arranged currently. And I stress the word currently. Okay. So I thought it would be great to hear how DEI is being evaluated and rolled out at other organizations. And I've done quite a bit of work with the American Society of Clinical Oncology. And I was very happy that Dr. Christopher Cross was able to join us here at SWOG to give us his view on these topics, as well as ASCO's approach to DEI. So Dr. Cross is a biomedical engineer, anatomist, neuroscientist, population geneticist, cancer biologist, LGBTQ advocate, as well as an entrepreneur. He is a founder of Cross River Strategies. It was a US-based boutique consulting firm that uses community engagement and scientific research to power health equity. He is currently the Director of Health Equity Strategies at the American Society of Clinical Oncology, and he advises and supports the design as well as implementation of equity, diversity, and inclusion strategies across the ASCO enterprise. It's nearly 50,000 members and external stakeholders. So with that, welcome, Dr. Cross.
Good afternoon, everyone. It is my honor and privilege to be here, and I'm looking forward to telling you more about what are we doing at ASCO and with regard to EDI. And just a little bit more about me before we get into the talk. As Dr. Dazan mentioned, I'm the Director of Health Equity Strategies at ASCO. And so what does that really mean? As you know, ASCO was founded in 1964. We've been around almost, I guess it'll be 60 years next year. And we've been in this space for a long period of time. But really until recently, we've been even more intentional around infusing equity and EDI principles in everything that we do. And so my background to be in this role, I did my undergraduate at Georgia Tech in biomedical engineering. My master's is in neuroscience from Howard University, and my PhD is also from Howard. Like you said, focused on population genetics, but I really focus more on respiratory disease. And then my postdoc I did at Yale University and Yale School of Public Health, focused more on cancer biology. So, and it was a cancer biology training program. We kind of this dual mentorship between academia and clinic. So I know there's some folks here from Yale Cancer Center. And so, and then I started my company, which is a consulting firm that focused on health equity strategies and across those different fields. And so I really love this role. It's an inaugural role within ASCO to really kind of bring together sort of innovative approaches and strategy to really think about these things in sort of a new way, but also anchored in how we've done things in academia and in the clinical setting. So I'll go to the next slide. And again, so this talk is really focused more on telling you what we've been doing. So that way, if you have questions with regard to what I've been talking about or things that you see are interesting, we have an hour. So feel free to raise your hand and I'll do my best to address that, because the goal is for this to be more of a resource and a dialogue around like, oh, I'm curious about that, or, oh, that's interesting. How do we implement that? And so that's how I think this talk may be best utilized for your benefit. And so on this slide, it's showing the most sort of up-to-date things around ASCO's community. So as you know, we're a global community, nearly 50,000 members. A third of those members are international, and we're in 170 countries. And we have some really new things around membership that you can see on join.asco.org. And just quickly, I'm curious, how many folks in the audience are ASCO members? Can you raise your hand? Okay, so there's a lot. All right, so don't tell my boss if this doesn't go too well. So let's see, next slide. So I'm starting the presentation off really with this slide because this is really the time period where ASCO became super intentional around infusing equity. We revised our mission statement by talking about equitable patient care. So our new mission statement in 2020 was conquering cancer through research, education, and promotion of the highest quality, equitable patient care. And as you all know, revising a mission statement with SWOG being about, I think, 10 years older than ASCO, there's a lot that goes into that. So it was a major milestone for us to change our mission statement to talk about equity. And so I'm going to talk about a number of things that I've selected for this audience, but there is more information on our website. So asco.org/equity. And you'll see a lot of really interesting things I'm not mentioning in the talk, but Dr. Dizon, I think others, have been part of certain task forces and committees, and there's a lot of resources that you can look at on the website. And so this is something so I've been at ASCO just over a year, and this EDI Blueprint report is our first ever EDI report talking about our EDI portfolio. And that really came down from Dr. Huddis, our CEO, and then through my boss, Sybil Green, and then to me. So I really worked across the enterprise to put this together and try to honor all of the things that we've been doing for the last almost 60 years in this space. So in this report, it really kind of pulls together all of those things. And I think for the first time in a comprehensive way, packages the information so folks who may not be as familiar with ASCO, who tend to think of us as like the big conference that happens every year in Chicago. But beyond that, we have journals, we have programs, we've international programs, and a lot of other things. So within the report, you will get a better insight into what's going on. And also the way that it was built in the appendix section is designed with a lot of live links. So if you see a program that's interesting, you can click the link, it'll take you to that web page and just tell you even more information. And so within the report, this welcome letter is, there. And I think sometimes welcome letters don't get, I think, the attention that they deserve. And because this was my primary project, a lot went into this. So I was like, I'm going to take this opportunity just to show it off to you all. But essentially, it chronicles ASCO's commitment to EDI. It talks about one of our 7 founders, Dr. Jane Wright, as an African-American woman, infusing the conversations about equity and equitable care from our founding, as well as building on that legacy with Dr. Lori Pierce, and also her presidential theme in 2021, which talked about equity every day, everywhere. Equity, every patient, every day, everywhere. And which really, honestly, changed a lot of the way we were doing annual meeting, the way we were doing programming. So it was really substantial. And our more recent presidents are building on it as well, with Dr. Weiner, who was our past president, and then now with Dr. Lynn Schuchter. And in closing here, what's also kind of cool about the welcome letter is that it's signed by both Dr. Huddis and Nancy Daly, who is our CEO of Conquer Cancer. And I think as an organization like SWOG, you can appreciate sort of the nuances of your 501c3 versus ones you partner with. And so we have that similar dynamic with, ASCO as a society and Conquer Cancer as our fundraising arm. So this effort could not be done without our volunteers, a lot of you in the audience and members, as well as our funders that support, the lion's share of all this work that we've been doing. But what I love in closing on this is how we talk about the work is challenging, the journey is long, and the advances are slower than we would like, but we are proud of the progress we are making on behalf of our members. And so this is not going too deep in the report, but these are the 22 programs that we highlighted. And the dark blue are the 8 programs that we went into a little more depth within the report. And so for this talk, I know SWOG has just been killing the game with clinical trials for a long time. And so I extracted one of the programs that we talked about in our top 8 as our research site self-assessment, because some of you may be familiar with this resource, but some of you may not. But at our website, www.asco.org/ASCO-ACCC, there's a lot more details about tools you can utilize to enhance your ability to track and document and hold yourselves accountable at different research sites to make sure they are equitable and advancing health equity in the ways that you want. And there's also different tools around implicit bias that we've seen some really, really effective ways in how it can be used. Because I know that topic, sometimes people are like, how often do I need to be refreshed? And, when can we use it? And if you go to the website, you can learn more about it. There's more details with that. And this is just showing some key milestones from that collaboration we've had to now our site self-assessment, where we've had over 75 sites participate in our pilot project. You can see the manuscripts, our different recommendations, and then, as I mentioned, the implicit bias training, the site self-assessment tool, and a list of evidence-based strategies for different sites. I put this here so you can get an understanding of our leadership. And so this is our current 2023 to 24 Society Board. Again, our past president, now chair, Dr. Weiner, our current president, Dr. Schuckner. And so her presidential theme is focused on the art and science from comfort to cure. And so you'll see more things coming, from her leadership during this year around what we're doing to really advance that. And she's expertise is in melanoma and focusing more on palliative care, which is something that I know is hard to talk about, but it's a very real element, and it does have a strong equity component. So we're working with her to make sure we are infusing that into programs and things that we're going to be doing. And so this is the society board members. And so for those of you who are not ASCO members, out of that big 50,000 number, there's about 300 to 400 of those members that are deemed volunteers. And so what you're seeing here are a subset of those 300 to 400 individuals that are on our board that actually decide how we move and change and develop strategy for the organization at large. And so I just always find that that's important for you to kind of see the people that are really passionate about EDI and making sure we are moving forward in our plans. And that being said, I know I had a conversation with Rick earlier around the questions we use to talk to our board around collecting demographic data, especially SWOG information. And so we've actually had those conversations with Sybil, myself, Dr. Dizon, and Rick around how do we share best practices on asking these questions. And I think many of you in the audience, being clinicians, there is this level of vulnerability, there's this level of risk that is real that we know our members face. So a lot went into making sure we are asking the questions in the right way and trying to make sure we have the IT security in place to protect that data, because I know a lot of our members want to get that information, some do not, but it is our responsibility as an organization to make sure you know why we want that data, why it's important in effort to actually advance our strategies. So what you're seeing here is the first time we're being transparent around what do our board demographics look like across both the society and the Conquer Cancer Board. So if you haven't caught wind, I'm really plugging this report. And so you'll see in this last paragraph here, the report focused on all of our activity for 2022. We released it at annual meeting in June. But during that same time, after annual meeting, we had our board retreat. And so what you'll see kind of reflected here at this last paragraph are the culmination of those conversations from the board retreat around how are we revising our strategy and our goals. What we're going to look at now, around access, knowledge, and the profession. And so that's what you see here. This is our revised strategic plan that will be what we are all adhering to advance over the next 5 years. But what you'll see is sort of, there's a few new things. So access, profession, and knowledge, they didn't replace our mission pillars, which are research, education, and quality. These are our new goals that how we will realign our programs and develop new programs to tackle these new areas. And so as the through points throughout the organization, you'll see EDI and global impact. And that's major, right? Because now my boss, me, the whole center, we are really becoming infused without the organization. And it's a lot of work. So we are going to do our best to make sure that happens. And then you can see at the bottom our flagship program, which I don't think really changed. So ASCO senior staff, these are my boss and their peers, are a lot of the VPs and the executive teams who are so passionate about this space. I think a lot of you who have been a part of ASCO for a long time will see some familiar faces. And some people you know, I'm sure very well, that have been, moving the needle since we've been in our founding. But my boss is the woman in yellow, and she's the Chief Equity, Diversity, and Inclusion Officer, Sybil Green, and Vice President of our Center for EDI, which was established in 2022. So if you're kind of tracking on the trajectory, 2020, we changed our mission statement to have equitable in it. 2022, we have our center. And then so Sybil's the inaugural VP. Then we have, and there we go. I put this on here for a reason. So you can see all the staff. And so Sybil's there, Rebecca, we are infusing ethics as well into our center and how we approach things. Myself, Janet, Dr. Camacho, and Alex. And this is sort of our mighty team right now within the center and how we are executing and building on this purpose for ASCO's EDI goals. And so in this diagram here, we spent a lot of time thinking about how does EDI live and breathe within the organization? So this is starting to showcase that. So with regard to EDI specifically, we know that we're really focusing in on the organizational management part. And what are sort of our two stakeholders that we're really working with in that space? Our governance and our members. And then the healthcare equity piece, which is really where my expertise is, it's about how do we do the work we're doing and how does it have this through point through our members, which are you yourselves, to then improve cancer disparities of people with cancer. As well as also our members, how do we make sure you feel empowered to do the work you're doing? How do we lobby on your behalf to, reduce barriers so you can do your job effectively and have better relationships with your patients? And so this is the center's 2023 priorities. You'll see here, there's a lot of different buckets at the bottom. And so we can talk, it highlights everything we're kind of been doing within this year and some things that are going to carry over, but essentially accountability and reporting, strategic partnerships, ASCO's journals, global health equity, long-term health equity strategies, and internal equity. This is something I'm super excited about sharing. We now have an approved new volunteer committee, and it's called the Equity, Diversity, Inclusion Committee. And so the Center for EDI will be the primary staff support for this group. And a lot of you who raise your hand as ASCO members, this is a big deal. Like ASCO doesn't really create committees very easily. We will do task force, which are very time dependent, focus on a very particular task. But to create a committee means we are really moving forward on our word to make equitable care a part of our model, because this way we will have a volunteer structure that will have reporting to the board. And then as you can see with our purpose, it will have the purview to really talk about how do we deploy, how are we being accountable? A lot of those things I talked about in the previous slide, how are we executing those within and across the enterprise? And so I'm going to read these because they really speak to what this committee is going to be focused on. And so the purpose is really to address inequities and eliminate barriers in oncology by advising the society board and other volunteer groups. And so that's major in the sense that I think we've got over or about 20 different committees. Those of you familiar, we have care delivery, we have policy and advocacy, we have even our Conquer Cancer fundraising arm, we have ESPD, so education, science, professional development, our meetings, the conference, annual meeting. There's a lot that ASCO does, and this way, with this establishment of this committee, we will now have the ability to query and ask across all of those different departments, how are we advancing EDI? Do we have something in place? Are we getting representation from all of these different groups that we want in these spaces? How do we even talk about our volunteers? Are we having diverse amount of volunteers? How are they being selected? Because as you know, the president, or some of you may not know, the president who's elected and that staff and the board, they have some purview in who is joining the heads of the committee. And then the people who are on the committee get to choose who they want. So it's very important to make sure we have sort of an agnostic element that's infused in the choosing of who is joining these committees as well. So that's somewhat of a new thing. I mean, we talk about it intentionally all the time, but it's different to have like an accountability partner, if you will, that can help make sure that that's happening. And so that's going to be one of the roles of the new volunteer committee. So again, the comprehensive development, prioritization, and implementation of ASCO's EDI agenda, domestically and internationally, across ASCO's mission pillars, and ASCO's oncology workforce with people with cancer and for all ASCO members. So clearly, this is going to be a very busy time for our center. And another thing I'm super, super proud of is at the same time, we got approval from the board for our EDI committee. We also got approval for our sexual and gender minority advisory group. And so that will fall under the hierarchical structure of the EDI committee. And so we're currently still in the process of getting the rosters and getting meetings. And as you know, you all schedules are very, very busy. So we're trying to get things scheduled. But I just thought that this was super exciting. And honestly, Dr. Dizan and a number of folks that were on our SGM task force that was in one of our other committees were really instrumental in us even revising this volunteer group as an advisory group. I don't know how many years it's been, but we had kind of sunset AGs in general. But because of our volunteers that have been passionate and moving the needle forward in the SGM space, it was enough for us as staff to take these conversations to then our leadership, which then took it to their leadership, that then was like, okay, we are going to revitalize the AG volunteer structure and put it under the EDI committee. So can we just have a round of applause for ASCO on that? And then I'll read the purpose here. It's to enhance ASCO's understanding of challenges and opportunities related to the care and treatment of people with cancer and the health and professional satisfaction of members of the oncology workforce who identify as LGBTQ+, and to contribute SGM-related perspectives to ASCO bodies, initiatives, programs, and policies. So again, our center will also be supporting this group as well. I put this slide here because after annual meeting, which was really great, we I think had like a record number of attendance and whatnot, 100% of funding across these different programs. And our center and the volunteer groups do not decide like who will be winning in these, but we will have a role in trying to make sure distribution of things are equitable. So I think that's important to know that this new committee will have some teeth, if you will, in a way that I think is tangible in making sure we're continuing to advance health equity through an EDI lens. And so 2024, these are more broad things that the organization is focusing on. So generally building on successes and understanding and mitigating inequities, addressing health equity barriers related to SDOH. And I know a lot of you in the audience, SDOH is just massive. So how we really talk about this, how do we deploy it? How do we make a difference? How do we show impact? We are having these conversations constantly as staff and with our volunteers to really try to figure this out. And we made a number of strides. We have a SDOH task force that was headed by Dr. Reggie Tucker-Silly, who's also now the chair of SWOG. And under his leadership and with that group and staff, we've made a number of strides, and we have like her policy statement that's coming out and some other things. So what else? We've got continued focus on diverse oncology pipeline, evolving research to identify and address barriers and improve and test interventions. And we have some other projects resulting from our 2023 work. So I put this slide here because a lot of you know that Dr. Bertinelli was a past ASCO president, and now she's the director of NCI. And obviously we're very proud of her and all our members. But through NCI and conversations, with President Biden, they talk about the cancer moonshot and the different phases. And I think, Lucy, I know you're in the audience, we were on a panel together back in Savannah, which is my hometown. And she talked a lot about the cancer moonshot in the NCI panel. And so that's what these next few slides are going to talk about. What is ASCO doing in that space? But just to kind of center everyone, they're focused on the next phase of the moonshot are the cut cancer death rate in half within 25 years, transform the meaning of cancer, address cancer-associated inequities. And these are how we're supposed to accomplish these new goals. So investing in the pipeline of new drugs for cancer prevention and treatment, ensure equitable healthcare delivery of current and new standards of care, expand clinical trials to speed evaluation of candidate interventions in diverse populations, and increase diversity of cancer research and care workforce to resemble communities we serve. And all of that is kind of new things coming out of Dr. Bertinelli's shop. And with the National Cancer Plan, I know a lot of you are familiar with these. There was a recent NCI panel where ASCO, among a number of organizations, were invited to talk about what is the work we're doing to advance those goals. And so our leadership, Dr. Huddis and Dr. Schuckner, represented ASCO to speak on the White House panel about what are we doing to address the things. So we selected 3 of our ASCO programs that we thought would best address those 8 topics that they have outlined in the RFP around what they want things to address. And so the 3 programs are ASCO Certified, Rural Cancer Care Access, and M-Code. And as you can see, all of these address the bucket around engage every person, and then 2 of them focus on eliminating inequities directly. But I would argue that M-Code also does that. It's more focused on streamlining data elements. And so if you do that for everyone, then I think, it can help address eliminate inequities too. But I wasn't, they decided that we wanted to make sure we could directly speak to those buckets. So if I was being a little more generous, I would probably tick some more X's. But this is what we presented, and you can see how we're addressing these big buckets across these programs. And I'll tell you a little bit more about each of the programs. So with ASCO Certified, it's a new program. It was previously called APC4. It's an acronym. Dr. Huddis was like, we need something short. We need something that speaks to it. So it's been renamed, rebranded ASCO Certified. But essentially, it focuses on patient-centered cancer care. And you can see there are a number of standards. And so we actually partnered with a few organizations to develop these standards, codify them, and really try to align them with a lot of the oncology business models and OMBs. And so you'll see here patient engagement, availability and access to care, evidence-based medicine, equitable and team-based care, quality improvement, goals of care, palliative and end-of-life discussions, as well as chemotherapy. But one of the newest ones that I really focus in for me from an EDI standpoint is the equitable and team-based care. So within that, that's one of our newer standards, and there is a health equity component within that standard that really challenges the practices, whether they're academic or large practice or small practice, to really think about how are they infusing equity in what they're doing. And so let me go to the next slide. So these are the current number of practices that are already enrolled and ASCO certified. We officially launched it after annual meeting, so more folks are applying, and I forget the number, but we've got we have a conference coming up, the Quality Care Symposium in Boston at the end of the month. And there will be a number of practices at that meeting to talk about their work with regard to ASCO certified and things that they've done. But what I find out is really awesome from a health equity standpoint is that every one of these pilot practices, because of that equitable team-based care standard, they're challenged to come up with innovative ways to address cancer disparities and cancer inequities. So as an organization, we now sort of are the repository of that information. And it's become a bit of like a learning collaborative, where that way somebody who's at a big practice or a small practice with a certain population or demographic that is really needs more attention to address those cancer disparities, that may translate to another practice that is in another geographic location of a different type. So we are, and that was, I think, somewhat of a, one of those unintentional surprises, which we're like, oh, this is awesome. And how do we now build on that? And for instance, somebody has created a like medical director of health equity at their practice. Other folks are focusing even more on Z codes and being more intentional about how do we collect those and actually utilizing that to increase their ability for reimbursement. There are other partnerships that they're doing with local grassroots organizations to actually address social determinants of health in their area. So we're starting to really learn across the country what are folks doing to address these things. Okay. And this is our other program, the Rural Cancer Care Access. So it's focused on Montana, and it's a hub and spoke model. And you can see the 2 sites there. And it's another opportunity for us to learn about in rural environments what is needed to really address those cancer disparities. And then let me see. This is just more details about the rural project. And this is the IMCO project that I was telling you about. So again, just kind of quickly, it will focus on the EHRs, and it will eliminate a lot of the duplicates, right? I think a lot of us now, whether we've wanted to or not, have become almost bootleg IT experts. And so we know that through our Excel sheets and outputs, there's a lot of duplications with things. And so this program actually helps eliminate those and has like more lists that you can then align your elements to, so that way it's being collected in the same way. And that way, if you opt into sharing, it will be shared with those common elements there. So that can make it more easily transferable to different partners that you have that agreement with. And this is a little more information. This was just talking about just showcasing our different journals for folks that may or may not be as familiar with ASCO. And then we have one of our new journals that has a new impact factor that's coming out. And this is also just kind of excite you as members. There's always these opportunities to lobby on your behalf to Congress. And we have a number of folks that we fly in, so that way you can talk to your legislators on Capitol Hill about your specific issues. And we also obviously provide resources and things for you to make sure you feel prepared in order to do that. And these are just some of the things that we have been focusing on the Hill. So of course, prior auth, the copay accumulators, and then generally supporting increase for cancer research. And just something again, because we want to make sure you all feel taken care of. We've also talking about, we partner with folks to develop better resources to make sure our clinicians are being taken care of as well. This is the membership that we've got, some free membership for students and trainees, physicians from lower and middle income countries. And then you can benefit from a lot of the ASCO things. And wouldn't be, I had to give a plug for next year's annual meeting, which, as you all know, is in the same place at the same time. So, and that's it. Thank you.
I am very inspired by what ASCO is doing. And I think as I was sitting there, there are things that we share in common with a group like ASCO, and certainly some programs which you could potentially envision are relevant to the work we do. So this is going to be the forum where you get to ask questions. Just to show you a couple of things, we have a website. This is where you can get information about DEI. Thank you to the Hope Foundation for sponsoring it. This is how we were currently organized. Okay. The vice chair position is the one I took on, and it was fully supported. I want to give a great shout out to Chuck Blanky, to Lucky Lara, and to Don Hirschman, who made this happen. And we are the only group to elevate DEI to a vice chair position. Recruitment and retention is a very close partner to the work we do, and it's chaired by Allison Caban-Holt, who's in the room. The Patient and Advocacy Council, previously chaired by Rick Bangs and vice chaired by Hildy Dillon, now under the leadership of Anne-Marie Mercurio. And, oh my God, Barbara Segarra. We have a DEI committee that is currently chaired by Dina Lanzi and Manmeet Ahluwalia. There's a leadership council, and standing here is Irene Tamimari, who agreed to chair it. And I'm going to ask her to come up here to field questions. We had a DEI fellow who started before I did, and she's transitioning to a special advisor, and that's Dr. Patricia Robinson. And then shout out to our first cohort of DEI champions, some in the room: Colmar Figueroa Mosley, Lucy Ganzauer, Manuel Ricardo Espinoza Guitarra, Jessica McDermott, Gayarthi Nagaraj. There will be a second group that we are going to fund in the coming year. Thank you to the Hope Foundation for agreeing to that. So SWOG at DEI, these are the 4 words I'll leave you with: transparent, inclusive, intersectional, but also iterative. I don't have the answers. None of us do. So we will learn from each other. And these are our major ongoing initiatives. We can talk about the SWOG membership profile. You please contribute your input to that. Rick Bangs is leading that charge for DEI. Patricia Robinson will be working on a checklist for DEI for the committee chairs and for protocol chairs. And we're working on an accrual dashboard. So these are things to help sites see themselves. At this meeting, we have the first event where you will get to meet our community advocates. And the 2 community advocates you will meet at a happy hour will be our LGBTQIA advocate, Joelle Pointon, as well as our AY advocate, Lauren Frizzell. And at this meeting, we had our Take Action Symposium focusing on digital tools and social media. And just another word that part of the role I play is about professional integrity. It's DEII. So what does that exactly mean? It means that we want to make sure everyone here feels like they belong. Okay. So what that is, it's a position where you can bring concerns. If you don't know where to go, or if you feel like your chairs aren't listening, that's what this is. It's how, if you don't know how to get engaged with SWOG, if you're new and you have no idea how this committee is assembled, if you want an introduction to a chair, this this position is now available, we can answer organizational questions in an effort to increase transparency. And what I can help do is get people together so we can listen to each other. We can facilitate resolutions. We can connect and learn from each other, and then also engage. So it is all about belonging. And with that, I will stop. And if there are questions, I want to make sure that we have plenty of time for it.
All right.
Irene.
Well, thank you so much. And a wonderful presentation. Kudos to what ASCO is putting forward in terms of DEI efforts. I am an epidemiologist and I work with metrics. So have you set up clear baseline metrics that you could, in 1 year within ASCO, repeat to assess the progress of everything you mentioned in there?
That's a fantastic question. And that's exactly what Sybil and I have been discussing. And honestly, even beyond us, a lot of the VPs. So to even be a little more transparent, the way we have tried to the way we are making sure to do that, Dr. Hudis has established strategy groups according to our 3 new goals. So access, profession, and knowledge. And so there's a number of different staff that are senior staff that are part of those 3 different groups. And we are challenged to make sure we come up with things we will be working on next year, as well as long-term, to make sure we are having impact. So that's what we're doing to try to make sure that happens.
Yeah, and my question was kind of to absorbing from you, as Dr. Deason mentioned, we are a group that is still trying to find its way of putting together a clear strategy on DEI efforts within SWOG. So it would be nice to hear from you and what you have done, so we could adapt it to our own environment. Thank you.
But I think that is just clearly the reason why we need to collect membership data. We want to know who we are in the room, and we want to do it in, and I use the term a lot, in an intersectional way, because we don't all live in just one dimension. We're not all white, we're Jewish, Filipino, gay, you know. We can be all of those things, and we can all find each other in different ways. So this is my plug for you to support the membership profile when it comes your way.
Great segue. Joelle Poynton, I'm the community advocate for the LGBTQ plus community for the SWOG PAC. I'm also on the DEI committee. So Dr. Cross, my question is for ASCO. Are they planning on looking at the sexual orientation, gender identity information, or what we call SWOG data for membership? Because my feeling is by so doing, they set an example for the clinical studies to follow suit. And also I would look to ASCO to be putting emphasis on the need to be able to do this, because until we start measuring that information, we don't have anything to work with.
Yeah. Dr. Dizon, we've had these conversations. But at the ASCO level, as you saw in the report, we have collected that information for our board.
Yes.
So with regard to our members collecting that is something that is in the works. I don't want to overpromise and underdeliver on that. But it is definitely conversations that we are having, and Dr. Dizon has been a part of those conversations. And I would like to say that we protect the data for our members, which is a big deal, especially now that we even have more. And as you know, because we got members all across the United States and in a number of different countries abroad, collecting SWOG information could be very detrimental or harmful or risky depending on where they live. So we are very mindful of that. And so we want to make sure we have that ability to protect them before we would, even volunteer for them to choose to identify, because we want to make sure we're protecting our members.
So you're talking about security issue, not specifically the collection of accumulated data. So
Both.
that you have an idea.
Even
of,
in aggregate. Mm-hmm. So
why would the aggregate run a risk?
So say we've got a few members that are in Algeria,
I see.
you know what I mean? And we report an aggregate and we're like, there's 2 people there, right?
No,
Even if we report an aggregate. So,
but as the ASCO, I'm an ASCO member. At the ASCO membership in general, you would not have that kind of.
Well, I think to answer your question, so we can move on, very important. What this room needs to know is that there has been a very concerted attempt to harmonize our efforts in terms of what questions to ask, but also to share concerns within what Rick and I and our group feel we need to make sure is in place before that rolls out. And we've talked to Sybil as well as to Chris about the issues and concerns. So I think there's a level of sensitivity of varying degrees with the extended data collection that is being asked. But it's really important, I think, because most of us are not just in 1 or 2 centers, that there's harmonization in the way they're asked. Because as a member of the LGBT community, if it's not being asked in the same way, it raises questions as to why you're asking it in a different way. So suffice to say, I think we are in the path to rolling out. I have to convince all of you as to why I'm rolling it out, why we think it's important, and how the hell are you going to keep it from getting out? And correct, and how are we going to use it? Dr. Hirschman.
So I wanted to highlight a program that, I was participating in and had the ability to review for, which is a partnership with ASCO and SWOG and the rest of the NCTN, which is the WIN Clinical Investigator Leadership Program that I think will be, people say, how do we concretely collaborate? This is a great way for us to concretely collaborate. And it's identifying investigators that we can bring into the group, that we can help diversify our membership and our leadership and, the people that are leading trials by identifying investigators that we can then mentor up in the group to help them achieve their career goals. And it's a great way that ASCO as an organization and we as an organization can concretely partnership, and other things like that, I think will help us both achieve those goals.
Thank you, Dr. Hirschman. Lucy.
Hi, Dr. Cross. You talked a little bit about the Z codes, and I'm not sure that everybody's totally familiar with them. I think they have a potential to really help us identify the differences in outcomes, particularly on patients on study or treatment outcomes. Could you expand on that a little bit and talk maybe how ASCO may be helping to try to get uptake on the Z codes? Thank you.
Absolutely. Our policy and advocacy department and our regulatory division really is very focused on a number of things coming out of CMS. And for those of you who don't know, Z codes right now are kind of voluntarily data elements that are linked to record and capture social determinants of health aspects. So for instance, you can, through a Z code, say my patient, one of the sort of potential barriers of access is transportation. So that's one of the data elements you can then sort of tick off, if you will. You can say this person doesn't have maybe like at-home care when if they have to have some sort of at-home treatment or chemo. You can talk about socioeconomic status. You can talk about a number of different things that you can, when you know about the Z codes, you can put them there. But the there's sort of a yin and yang with it, in the sense that people are, oh, great, this is a nice thing to do, but it's not required yet. So there's a number of stakeholders that are trying to make it a little bit more required. But as you know, physicians, you already have a million things to be recording and typing. So people don't want like another thing. But what we've done at ASCO is, honestly, through our regulatory division, we've been advocating more about bringing more awareness to the Z code so we can address SDOH. That's definitely an aspect. But also through our partners with our state affiliates, in particular with Flasco. I was there on a panel there, and there's organization with the Baptiste healthcare system, and they're focused really on collecting those Z codes, and they've been able to utilize them to increase their reimbursement from CMS. So that's something I know I talk about as a case study on how they have been used. And a number of our, I think, ASCO certified sites, they are all made aware of the Z code recording, those pilot programs that are a part of that. But that's what we've been doing to try to bring more awareness and a case study on how it has benefited our health system.
So while I'm waiting for someone brave enough to answer a question, I think we would be remiss to assume that everybody believes SWOG should be doing this work. And I think, you know, I look across the sea of faces here, and these are folks who I know believe that diversity is important. But just like ASCO is very keenly aware that membership opinions, membership views are not homogenous. The same thing is true within SWOG. Okay. There has been a lot of there's a very, very small minority of people who have been fairly vocal that clinical research is about treating patients, and knowing if they're gay or straight is not important. And I treat all Black people the same as I treat white people. And to SWOG's credit, and within the NCTN, our enrollment numbers for underrepresented minorities is probably double that of industry trials. So we do a good job. We could do better. But just look around this room and you will see the diversity within SWOG. But if any one of us came and said, what proportion of your membership is Native American, we have no way to answer that. And we need to.
Yes, I'm going to use this moment to do a promotional message. I'm one of the 4 investigators leading an educational effort aiming at improving cancer research among sexual and gender minority populations. So we have every year our workshop, 3-day workshop. The next year, 2024, will be in Houston, and we provide the free participation and support in traveling on meals. So this is open to clinicians, scientists, community members who wants to improve cancer research for sexual and gender minority population. If you have questions, please look for me at the end. Thank you.
You guys asked for this for?
Just a minor issue. I'm just curious, what is the leadership council in SWOG, and what's the purpose? Because I see that SWOG is making an effort on all these fronts, right? And so you're trying to figure how to bring it all in and make a culture shift, right? So some transparency around what all these structures are, I think would be helpful.
Yeah, so the Leadership Council is an informal one that only meets during the meetings. So there's the ask is very minimal, but what it is a group of people who can help me see what I cannot see. Right? So they're the ones that say, have you thought about these things? Or if I say, I think maybe we need to focus on that. This is the group that can help me think through that. And really importantly, those meetings are not closed. So even if it's a leadership council, you all can come. And I think that is even more important. Okay. But these are the 5 people. If I need to just understand better, you know, perspectives, this is what this group is helping me do. And it was formed through the on the advice of very, very good people within SWOG. And I'm very happy with the leadership council that Irene has been able to assemble. What else?
Barbara Segarra from the Patient Advocate Committee. I just want to recognize our president of our chair of the PAC up to Sunday, Rick Banks, because we started as the Patient Advocate Committee talking and doing something about, doing more, right? Not something, doing more about diversity and inclusion. So I just wanted to take this a moment to recognize Rick Banks for his initiative and bringing, and we started the community advocates and all the things. And the first community advocate was Latina. I was a Latina within the PAC, but as a community we have one. So I just wanted to mention that.
I think if we're going to do the kudos, in addition to Rick, the other person who really got this moving when Dr. Blanky really wanted to make this happen for us was Allison Cavan-Holt as well. And their 2 brains put something in motion even before the vice chair position was even before we interviewed for it. So thank you very much for your efforts as well. Wow, nothing. All right, so I think what, not to draw this out then, if there are no questions, 2 things is that you can always reach me. All right, just stop me at the meeting. You know, email me if there is an issue that I can help with, or if you don't know where else to go with. Okay, I think that's really important. But that, you know, we're probably gonna make some mistakes as we make this happen. And I think that's okay, because everything that we're going to do here is going to make us better. And we're already starting at a really good place. And we should be very proud of that. And partnerships and hearing from other organizations, especially one close to many of us like ASCO, it can show you what's possible, you know, and it's not about putting anybody down. It's about lifting everybody up, because again, you all belong in SWOG. We just have to make sure we utilize the talent that each of you brings. Okay. Thank you. Thanks for coming.